Oh, are we live? Okay. Hello. I never know exactly when we started or not, so I think we're getting going here. Yeah, participants are joining. Welcome everybody. Good Tuesday to you. Today is a beautiful day here in South Dakota. The sun is shining, the wind is blowing. A snowstorm is coming in 2 days, so I am not really excited about that. I went golfing yesterday because I knew that was coming, so I actually had two birdies, so that was fun. I often get birdies. I almost
How
got a hole in
exciting.
one. Like I rolled
Yeah.
it just never had a hole in one in my life. Yesterday was almost the day. So Scott, good morning. How are you doing today?
Good morning. Excellent. I'm in Lancaster, California, where it's beautiful. Beautiful.
Lancaster. All right.
Yeah.
Yeah, it looks beautiful. I have not been to California in a while. I got to get back out there soon. We got to do these together, like live, right? Sitting in the same room. That would be great.
Hey, in October we can do that.
And it would be a business expense. I could write that off. Uh, well, good morning, everybody. Thanks for joining us today. Welcome to another episode of the Diabetes Reversal Webinar. I'm your host, Joe Barton with Barton Publishing, and my co-host, not just a guest, but my
There you go.
co-host,
Thank
Dr.
you. I'm no
Scott
longer a
Saunders.
guest.
Yeah,
I'm going up in the world.
you've been upgraded. Scott, welcome. And today we are going to talk about diabetic supplies, avoiding clots on long flights, and we have a couple of good questions that have come in that we're going to talk about regarding insulin and blood sugar and all that. So real quick before we get started here, just want to say thank you for joining us. We're glad you're here. We do this for you. We want to answer your questions and be helpful and add more to the diabetes solution kit that we teach from. And so questions coming in, we appreciate them. You can ask them through the Zoom channel. There's a little Q&A section down there you can do. There's a chat feature. We see all of that. And we'll get to your questions. We love to have them, and we'll even welcome people if they want to hop on video and say hello and share a testimonial or a question. And so, yeah, all good stuff. So real quick, we need to get the disclaimer out of the way. And this content that we talk about today has been being made available for informational purposes only and educational purposes. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding your own medical situation. Never disregard professional medical advice or delay in seeking it because of something you've seen or heard. So, all right, with that, let us get started and let's talk about diabetic supplies. So, tell me what is the average? What does it look like cost wise for diabetes supplies? I mean, people are doing finger pricks and monitoring and
So,
all of that.
so it's been a while since I've bought any supplies, but people generally tell me that the little machines are pretty cheap. You know, you
Yeah.
can get them for $20, $25 at a Walmart or a pharmacy. And that doesn't cost much. It's the test strips.
Yes.
You know, they're like $1 a strip, and so you think about it. You know, it's not that much, but $1. But if you're checking 5 times a day, that's $5 a day. That's 30 days in a month. $150 a month just for your test strips. You know,
Yeah.
it can add up, and
Yeah.
so the way they get you, it's kind of like the printers. Your printer's super cheap, and then the ink is like, oh my gosh, ink is so expensive,
Right.
because you can only buy their ink and nobody else's.
Yeah.
So it's the same kind of thing. So if you buy their machine, then you have to buy their test strips. So when you're buying a machine, look into that. Look into the cost of the test strips more than the cost of the machine.
Right. Yeah, because once you get into a machine, you have to use that certain brand or type that works in it. And
Yeah.
oftentimes, they give away those monitors for free because of the
Yeah.
expense of the test strips. So, is
Yeah.
there any difference in quality in that you've seen, like if you go to Walmart or your local pharmacy to buy a monitor or test strips that are any different that you recommend or not?
The technology of the monitors is pretty good all the way around. If they are released onto the market, um, then they get you close either way. I mean, if it's a difference of 10%, that's allowable. So 10% would be, instead of 100, it says 110 or 90. That's not really that much of an issue. But if it's 200, then you might be 220 or 180. Either way, you're in that same range, and it's letting you know that your blood sugar is high or your blood sugar is normal, and so it's giving you the information you want, even if it is the allowable 10% difference. So if you check your machine against another machine, you go, wait a minute, mine says 180 and his says 190. That's the same range. That's not something to really worry about.
Sure. Yeah.
They're
Okay.
pretty good.
Yeah. Yeah, that makes sense. Okay. Let's see. Work on the speaker view. Okay. Kevin, how's that? We're testing our video views. There we go. Okay. So, other topics regarding diabetes supplies, and so there's different types of aids that people can use. For example, diabetic socks that you can wear that help with circulation, and other things like that. Can you talk about? Yeah.
Yes. Okay.
Okay.
Shoes, socks. If you're wearing shoes that are pinching your toes and cutting off circulation, one of the issues with diabetes is circulation, especially in the small vessels. So if you have something that's putting pressure on your feet on a certain spot, for example, then you're more likely to get a wound there, an ulcer or something. And if you don't have good feeling in your foot, then it can become infected, and that's where people end up with like even amputations of their feet,
Yeah.
because the infection then can take over and get into the bone, and it just you don't have enough circulation there to cure that. And it can get away from you. So that's why they make these diabetes supplies for circulation. They're stockings that allow enough pressure to get the venous blood back to your heart without putting too much pressure to cut off the circulation. The same thing with shoes. If you've seen those really wide-toed shoes, I had a patient that just hated that idea. I can't wear those shoes. I can't wear it. She ended up wearing them because she was getting lesions or ulcers on her feet because of the shoes she was wearing.
Hmm.
So she ended up getting some diabetic shoes, and she's okay with it now.
Yeah. I was
But yes,
watching. Yeah.
that's why they do that, is really for circulation.
I was watching an episode of The Good Doctor the other day, which my wife and I like to watch together. And there's always some interesting and like scenes that make you like go, ah, and there's this
They do
one.
that on purpose.
Oh yeah, for sure,
Yeah.
drama. But there was a guy that was, in for a routine checkup, and the doctor with autism spotted something, and he said, "Could you please take your shoes off?" And they weren't tied or whatever, and it turned out he had like major wounds on his feet, with to the point of la 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 maggots, like la la la, like it was just really but just kind of like, and they talked about like this is why someone would need amputation. It gets to the point where you can't feel anything, and
Yeah.
it's rotting flesh.
Yeah,
uh,
that's not far-fetched either. That I've seen cases of that where people hide their lesions. And then you ask, why did you let this go? This is really bad. We can't fix this now. If you had come in a month ago, we could have fixed it. And
yeah,
they say, well, I didn't feel it.
yeah,
So they lose the feeling, they lose the sensation, and they don't feel pain. So it's kind of like your toothache. You don't go to the dentist unless it actually hurts.
yeah, right. Well, so I mean, that is a natural segue for us to talk about Nirvana, which is one of the supplements that helps with diabetic neuropathy, nerve pain, numbness, tingling, all of that. It's alpha lipoic acid. Let's see, 600 milligrams of alpha lipoic acid, and then 75 milligrams of benfotiamine. And yeah, I mean, that helps people that can't feel their feet. I don't know to what extreme that it can actually, if you get to a certain point that you're over the edge and it's,
Yes,
beyond
you
repair.
can get you can get over the edge.
Yeah.
It's really, when you look at the research on those two nutrients, it's a statistical analysis. It's not that everybody got better. The ones, of course, who had the least disease got better the fastest, and some of them were completely reversed. So
Mhm.
if they had like the tingling and a little bit of numbness, a lot of that was able to be reversed. But people who had completely numb up to their knees, that's not something that's easily reversed. And
Good.
Nervala may stop the progression, but probably is not going to reverse that kind of thing.
Yeah, that's pretty extreme. I mean, yeah, that's why preventative health is so important. And when you start to feel symptoms or see symptoms, like, take action right away and research it. And that's, that's part of the reason why we have the diabetes solution kit and our business and our products is to help people in those earlier stages specifically. I mean, we can help people with major reversal that have had diabetes for years as well, but it takes
Yep.
all the more effort and
Yep.
yeah, determination. So, but and so, yeah, if you're not familiar with the Diabetes Solution Kit, this is the product that we teach, the three-phase system. And just for review, Scott, if you want to just talk about like type 2 diabetes specifically, it's really too much sugar. And that's really the definition of, like, too much sugar in the blood is what diabetes means. But the remedy to get, to reverse the symptoms of type 2 diabetes is to lower your sugar. And there's many ways to do it, but the fastest way is to, well, by fasting, also with just reducing your carbohydrate intake to 20 grams a day. So yeah, if you want to just touch on that real quick for our new listeners.
Okay. So diabetes is literally means peeing too much, and so that's why you have all these different types of illnesses that are called diabetes. You have one where your pituitary gland doesn't work and it makes you urinate a lot, like you have to get up all the time at night and you're thirsty all the time. And then there's type 1 diabetes and type 2 diabetes, which are kind of opposite illnesses. Type 1 is not enough insulin. Type 1 is too much insulin, or type 2 is too much insulin. And type 2, like you said, is too much sugar. And type 1 is not too much sugar. Yes, there's high sugar in the blood, but you can't get it into your cells. So you're actually losing muscle mass because you can't get energy into your cells. Whereas type 2 is just the opposite. You're getting bigger and bigger as your cells are trying to make all this sugar into fat. Excuse me. So um, the way as the cells become packed with sugar, it's essential that you use up that sugar to get rid of the insulin resistance. So that's why exercise is an important thing. But the other thing, that probably the most important, it seems, is to not add any more sugar into that cell. Once you stop putting sugar into it, then it will start using up the sugar that it has stored, called glycogen. And so that's the way that the solution kit works. It starts with just getting way down on the sugars and carbs and getting down to 20 grams and staying that way for a while until you start using up, your cells start using up that sugar, and you start getting sensitive to insulin again. Then you can go into phase 2 and start sort of fooling around with your diet and adding things in and seeing where it goes. And that's where today's lesson comes in, and that is having a monitor, knowing where you're going. If you get into a car and you don't have a speedometer, then you don't know how fast you're going. And so the officer pulls you over and says, "Do you know how fast you are going?" And you go, No, I don't have a speedometer. then
Ignorance is
you're in,
bliss.
then you're in big trouble.
Mhm.
But it's the same kind of thing. If you want to lose weight, and I have people who want to lose weight and they refuse to step on the scale every day. Well, how are you going to know? How are you going to know what you're doing? Um, and often people who do that gain weight. It's the same kind of thing with the blood sugar. You know what? Like we said, they're cheap. Get a monitor and check your blood sugar and see where you are. And you can even see, like, when you eat a certain meal, you can check an hour later and you go, oh my gosh, every time I eat um, sweet potatoes, my blood sugar goes up. Or some people, I've had a few cases of people with high protein, their blood sugar goes up. So it's not a simple case of everybody who follows the book is going to be, exactly get rid of their diabetes and be able to work with their doctor to get off medications and all of that. It's not that simple, but you can individualize it by testing. And that's why we talk about testing supplies. It's important to know that. That gives you knowledge.
Yeah. You mentioned testing 1 hour after eating, and a lot of times we see the numbers that are put out there as like under 100 is good for fasting blood sugar, like in the morning after not eating for 12 hours or something. But what should your blood sugar? What's the acceptable range of your blood sugar on 1 hour to 2 hours, after eating?
Oh, that's a great question. And optimally, it should be under 120. That would be like a non-diabetic range. But if it stays under 150, that's pretty good. If it goes over 200, you still have a lot of work to do.
Okay.
So that's kind of the range.
So like your highest level of blood sugar really should still be under 150, even if you're eating food.
Even right after a meal, yes.
Okay. Yeah, that's good to know. Yeah. Because a lot of times, if you're only testing when you're fasting, uh, that doesn't show you the whole picture of everything. Yeah.
Correct.
Yeah.
Exactly.
So
Exactly.
we had a question come in. Let's see if I can find it, from Patrick. So okay, the question is a high blood insulin level dangerous as long as normal blood glucose level is maintained? I'm thinking about the case of artificial sweeteners spiking insulin level without significant blood glucose to act upon. So is high blood insulin level dangerous?
Um, the caveat that he put in there is that as long as blood sugar is maintained.
Right.
So high insulin with a normal blood sugar, or even a high blood sugar, tells you that you're insulin resistant. So in the immediate sense, no. High insulin, insulin has, as long as you keep your blood sugar normal, high insulin doesn't matter much at all, and in the short run, in the immediate sense. However, over the long run, over years, the high insulin level will it will block energy from getting into certain cells of your body, which include nerve cells, which is what we were talking about today about with the diabetic neuropathy in the feet. That doesn't happen because the sugar's high. It happens because the insulin is high. And this was learned many years ago when they started doing research, and they found people with neuropathy and even kidney disease before they ever had high blood sugar. So they're testing the blood sugar. It's normal, 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 normal. And then before they become diabetic with high blood sugar, they already have significant disease to their nerves and kidneys and even heart and all that. And
Hmm.
so the question of why came up, and it's really the insulin blocking the energy to get into those cells. And so the insulin resistance is a bigger problem. So
Yeah.
the answer to his question is immediately no. As long as your blood sugar stays at a good range, the high insulin's not an immediate issue. But long term, yes, absolutely. That's the big issue for complications.
Okay. Good. Hope that helps, Patrick. It looks like you're on on the call with us too. So let us know if you have any other questions related to that or anything else. So thanks for asking the questions. We love that. And somebody else had asked what the name of this supplement was. It's called Nirvana, and we named that after Nirvana. It's kind of a play on names, but it's Nirvana with ALA at the end. ALA is alpha lipoic acid, so that's one of the key ingredients in there. So Nirvana, we've got a link on bartonwebinar.com if you want to go to that site and click on the link for Nirvana if you'd like to get some of that. Also, I believe we still have a special coupon that you can use to save $10, and that's webinar 10. Just enter webinar 10 at checkout and the code, and you'll save that right off the bat. But yeah, Nirvana for nerve pain, and this also helps with blood sugars as well, and other things. It's not just for neuropathy and nerve pain. I mean, ALA has multiple benefits. Do you want to talk about that real quick?
For nerve pain?
Well, for like, how does ALA and benfotiamine, which I think is vitamin B1, right? How does that help in the battle?
Yeah. Okay. So benfotiamine is a type of vitamin B1. Vitamin B1 is normally water soluble, and so it's only found in the water compartments of cells. But benfotiamine is a fat soluble, so it has two things associated with it. One is it can be stored in the fat, and so you have a constant supply of vitamin B1 there. But also it can have its action in the fat layers to prevent inflammation, damage to the nerves. And so it can help the nerve function better with the B1, the vitamin B. One of the reasons they're associated with all Bs is because they're vitamins that are needed for energy production. They're needed for the cells to make energy. So this particular one just improves the function of the cell to be able to make energy. Alpha lipoic acid is a similar kind of issue. It's an acid, but it's a fatty acid. So it's also partially water soluble, partially fat soluble. So it works to decrease inflammation. So it's an anti-inflammatory, and it also works in the nerves themselves, because it can go, because it's partially fat soluble, it can go across the blood-brain barrier. It can get into the brain, it can get into nerve tissue and decrease inflammation. So that's how they work, apparently, as best we know.
I take this myself every once in a while, and it helps me sleep better at night, just because I think my body temperature goes up at night for whatever reason, and I feel like I don't like to use much for blankets and all that, but so I think it's related to my blood sugar levels. Probably had too many carbs or something like that during the day. That seems to be the correlation. And so if I eat less carbs and or have some Nirvana before bed, like, it seems to be like that plus magnesium. I think they're both helpful in that. So yeah. Does that make sense, or am I just imagining?
Yeah, actually, no. Another good way to do that is you said less carbs, but not eating at all at night.
Right. Yeah.
Carbohydrates is a high octane fuel and produces a lot of heat
Yeah.
in various ways. But people who stop eating after 6 o'clock, so they go to bed with an empty stomach, actually do sleep better.
Yeah.
So that can improve it too.
Yeah. Good. Okay, let's get into some other questions here. I don't see any that are currently on the docket here. Let me look in my document to see if there's any other ones. Feel free to jump on and ask a question, type it in the chat or in the Q&A section. Next week, we don't have a topic scheduled yet for next week, so I've got an idea for something that we could talk about. But
are you sure?
We'll have to talk about that offline, but we'll see as other people have questions too, and if there's other things we can talk about. One thing that would be a good topic is talking more about the 6 p.m. window. Stop eating at 6 p.m. and even like, it's not just 6 p.m. It's really having an empty stomach when you hit the hay at 10 o'clock. So if you ate pizza, at 3 o'clock, it might not be out of your stomach yet by 10. So, yeah. Okay, so we do have another question here. Somebody asked about juicing. Is it good for you, or does the lack of fiber negatively affect your blood sugar and everything?
Oh, that's a great question. Okay, because there's so much around juicing about how juice is so good for you, and it is a way of getting a lot of nutrition in uh, that you can't get if you ate it. So, for example, if you if you were to drink 16 ounces of juice, carrot juice, that's pretty easy. You could get that down in a meal. That's easy to do. But to eat a pound of raw carrots, 16 ounces of raw carrots is going to be really tough. That's going to be you're going to get so tired of chewing. So you can like concentrate all of that um, that beta carotene and the nutrients from that come out in the juice, and so there's benefits to that. On the other hand, to do that consistently, I have people that's all they do is juice, and you do get some soluble fiber in the juice. It's not fiber free. You just don't have the insoluble fiber, the tough stuff. Um, and the soluble fiber is good for growing the bacteria in your intestines, so that's okay. um, However, there are things in the whole food that are not in just the juice, and mostly that's fiber, but there are other things as well. So I don't know of any specific thing that you should do. However, with diabetes, if you're juicing, you're also concentrating sugar, and the concentrated sugar could end up making you more insulin resistant and preventing you from um, successfully managing the reversal program.
Hmm.
So while juice does have its good points, it also has some drawbacks. You know what I found? Can I just share something else that goes along with this?
Yeah.
And that is the uh, the human body. Well, all of biology requires um, differences. We have to have like a lot of something and then none. We have to have like light, like sunshine, and then we have to have dark. And we have to have hot and cold. And we have to have good and evil. We have to have choice. We have to have differences. And in our food, if we eat the same thing every day, even if it's really nutritious, I had a nutritionist who worked in my office who was reading about kale. Kale is the most nutritious food in the world. The nutrient to calorie ratio is the biggest of any food in the world. It is great. So she goes, wow, I'm going to eat kale from now on. So she ate kale every day, kale every meal, kale. She got toxic on kale. She
Hmm.
was getting cramps in her muscles. She couldn't sleep at night. She's going like, what the heck? I am getting worse. And she found out about oxalic acid in kale. You just can't eat it every day. It's super good for you, but that you have to have some moderation in everything you do. And it's not doing the small amounts all the time. It's having a large amount and then having none at all. And that's where juice comes in. If you're going to have juice, yeah, make some juice. That's fine, but not every day or
Yeah.
not with every meal.
Right. Yeah. And there's a difference too between juicing and making smoothies in a blender or something too, because if you put in like some, like kale or carrots and maybe some berries and some ice, you can make a nice smoothie that does retain all of the fiber, and it's thicker. It's not
Correct.
just the juice. It takes a little bit more to drink that. So I would think that would probably be a little bit better alternative to juicing.
Well, possibly. I don't say there's anything wrong with juicing. Like I said, it's a good way to
Yeah.
concentrate nutrients. But as far as like for the sugar, absolutely it's better because with the fiber, it slows the absorption of the sugar, so you don't get spikes. You get a more rounded um, absorption of the sugar. So yes, the fiber has that advantage.
Yeah, you just have to be careful. It's easy to put all sorts of stuff. Like you could put 5 different fruits in a smoothie and have way too much sugar. So
Yep,
yeah,
yep,
yeah,
it's easy to do.
yeah. Yeah, I want to invite, we've had some good interaction here. Skip or Patrick, if you're still on, or anyone else, if you would be bold enough to just hop on video with us, we would just love to hear some people share a little bit of their story. Because when people share their story, what they've gone through, the struggles they've had, and the successes they've had, it helps people a lot. It, so if anyone would be willing to do that, just comment in the chat section here. We'd love to have you on and just say hello and get to have some interaction with people. And so even if you don't have a camera, we'll just to have a conversation. Patrick, if you're up for that, we could add you on audibly, and we just love to say hello and hear how things are going. And I think it might also lead to a teachable moment. So we have a few extra. We've got a little extra time here, so this would be a good way to kind of finish up the
Well, we,
last third here.
well, we haven't talked about the clots yet on the
Oh,
airplane.
okay.
So.
That's great. So until then, let's talk about blood clots and flights and all that. How do we prevent that? I think we touched on it a little bit last time, but let's get into it.
Yeah, we did. We talked about it a little bit before. So the keys to preventing clots. It's really interesting. On a long flight, more than 8 hours, up to 10% of everybody on the airplane gets clots, measurable clots. Where when they actually did studies on it, they said, "Wow, way more people are getting clots than we thought." So it's not that uncommon.
Hmm.
It's not something that's rare. For example, it's something that actually happens frequently. So, so how do you prevent clots? Well, one thing really important is to be hydrated. Having enough water is significant, so that your blood is not too thick, so to speak,
Mm-hmm.
so that you have good flow. As long as you're having good flow, then you'll have less of a chance of having clots. So um, another thing to think about is why do people get clots on airplanes? Why airplanes? And why not other times? Well, a lot of it has to do with the way the airplanes are set up. In a car, for example, seats are low and you put your feet out straight in front of you. In most cars, whereas in an airplane, the seats are high, you put your feet straight down, and some people don't even touch their feet don't even touch the ground. And so they're resting on those veins right behind the knees, and so they kind of get sluggish circulation in their lower legs, like through the calves and the lower extremities.
Hmm.
So getting up and stretching out periodically, or stretching out in your seat periodically, getting your legs straightened, moving your calves a little bit, and keeping the circulation there is a good way to prevent clots from happening.
Hmm.
Some say that that you can get up every hour or so and just walk up and down the aisle and then go sit down, and that's fine. That works really well too.
Yeah.
Except if you think about it, 300 people on an airplane all walking down the aisle every hour.
Yeah.
That could be a lot.
Yeah.
But so the other things are inflammation. A lot of people get clots because they have extra inflammation in their bodies. And avoiding inflammation is really important. And the way to do that is to have normal blood sugar. That's important. So your inflammatory markers are down, and you can look at how much inflammation you have by doing tests. We do a C-reactive protein and a sedimentation rate, and there's other markers for inflammation to see what it is. In some cases, people who are susceptible to clots, we use a fibrinogen level to see if they're actually making clots in their body more than other people. So you can ask your doctor to do tests, or you can have them done to see if you're susceptible. And then what do you do about it? Well, you decrease inflammation. Uh, Omega-3 oils are a good way. You can take a large amount of curcumin before you go. Curcumin is a turmeric. We actually have turmeric available too,
Mm-hmm.
and that can decrease the inflammation before you go. And there are other anti-inflammatories. But interestingly enough, not eating on the flight is one way to do it, by decreasing inflammation.
Yeah. I was just thinking you could maybe boost your feet if you're hitting that nerve behind your knees. If you can boost your feet up a little bit and move the pressure further back to your butt. So
Yep, that kind of thing.
yeah,
There.
yeah, that's good. So hydration, reduce inflammation, and yeah, boost your feet. So very good. All right. So Patrick said he's willing to hop on with us, and so if Leslie could give him access to jump on and enable his microphone, that would be awesome. Let's see here. Let us know when he's got access here. There we go. Okay, I think Patrick, you're on. I think looks like you're not muted, and so hello.
Hello. There I am.
Hey, Patrick.
I'm calling from the Pacific Northwest of the USA, and the message that Dr. Saunders was just giving was very important for me because I make several trips across the Pacific, so I'm on some long flights there, 13 and a half hours, and I've done Australia flight too, so that was very helpful to me. I don't know if you saw earlier when we were talking about the test supply strips and things that they can be very expensive. I found that by buying them through eBay, the last batch I bought was 100, two little vials of 50 test strips for $38, and that was free delivery. So 38 cents a piece isn't bad, and that was for the One Touch Vario, which are popular ones, I guess.
Okay. How often do you use that to test your blood sugar? Several times?
I haven't been using it as much lately because I'm still educating myself on the 3-step program, and I have been cutting my carbs just as a just a basic starting point. But typically I'll test in the morning when I first get up, and then after a larger meal, maybe after lunchtime. I've also been avoiding the late meals. I've always been one that likes to get dinner taken care of by 5 or 5:30 in the afternoon.
Yeah, good. Well, thanks for hopping on here. It's nice to talk with you here, and
You're very welcome, and I want to thank you so much for making this program so affordable and getting it out to everybody, because my doctors are like most others, and they say, oh, once you're diabetic, you're in it for the long haul.
Yeah, Scott, why do doctors say that? Is it
Well, it's kind of like if you go to an acupuncturist, you're probably going to get poked with needles. And if you go to a chiropractor, you're probably going to get your back adjusted. If you go to a medical doctor, you're probably going to get medicine. And if they don't have something like a medicine that will cure it, like if you had a pneumonia, they'd say, oh, yeah, we can cure this. We have an antibiotic and we'll cure it. No problem. But if there's no medicine to cure it, then they're going to say, we have no medicine to cure it. So you have the medicine that we have, we'll treat it, and you can have that for the rest of your life. So that's why. It's just you get whatever they have.
Yeah, it's a totally different worldview, and it's education is such a huge component in really understanding what works, what doesn't work, and the reason why and the root cause. So, Patrick, would you share a little bit about your journey, like how long you've had diabetes when you were diagnosed, and more of that?
Yes, can you hear me?
Yeah.
Okay. I was diagnosed about 2 years ago. The symptoms were there much earlier. My brothers and some friends and I like to do some long Harley trips, road trips that'll take us from the Pacific Northwest, gosh, down as far as Albuquerque we've been. And we did a ride to see the eclipse a few years ago. We rode to central Idaho just because we wanted to be in the path of totality. And my symptoms were coming on pretty strong then, and my older brother had a stepdaughter that was diabetic, and he said, boy, you know, you're showing classic symptoms. So when I got back from the trip, I went into my doctor, which I hadn't been going to regularly in a long time. And yeah, they tested blood and A1C and everything ratted me out. So
Mhm.
I kind of was starting at that point, watching my foods. And so again, your program is much more what I've been dreaming of, hoping of. So
Good. Yeah, that's great to hear. So you tried some other things. Did you try, were you on metformin or anything like that?
yes, I was on metformin and also on, I think 10 units of insulin.
Okay.
That was, you know, pretty steady. And they had also stuck me on 3 or 4 different other medications. And I thought, you know what? Humans weren't designed to be living on medicines. And I'd always been kind of suspicious of big pharma.
Yeah.
And so again, yours is the system that's the godsend for me.
Yeah. That's great. Well, that's kind of our our big mission and passion is um, trying to help people get off of medication. We hear so much of the side effects and the different complications and pains, and it's yeah definitely not how God designed us. So yeah, we're thankful for you sharing that, Patrick. That's huge.
You're very welcome. I hope it's helpful to someone out there that's also listening.
Yeah, awesome. Well, thanks for hopping on. Appreciate that.
You're very welcome. Thank you.
All right. Okay. Well, we are getting close to about the time for us to wrap up here, but yeah, this has been a good discussion. And let me see, we do have one other question that came on here. Get that answered here. All right, Scott. Does diabetes affect your thyroid or muscle cramps in your neck?
Oh, okay. Yes and no. Only because the diabetes affects your metabolism, and your metabolism is all of the energy production in your body. So in a sense, yes, but not specifically. So the cramps in your neck are due to a lack of blood flow to the neck, and diabetes does affect blood flow. But there's another reason why it's specific to just that area. So if there's any kind of injury, if there's any kind of the cramping, for example, comes from a lack of blood flow, which is actually controlled by the brain. And most of the time, there's whole books on this. Dr. Sarno wrote several books on why people get back and neck pain, and it is a lack of blood flow from the brain controlling it. So that's one. And what was the other one? There was the cramp in the neck, and then what was the other?
Thyroid.
What?
Thyroid.
Thyroid. Oh yeah, thyroid. Okay, so yes, because your thyroid is your is the general hormone that addresses your metabolism, but that's the energy production, and then the diabetes affects the energy production. So while they interact, there's an overlap. It's not directly causing the problem. In other words, neither one of them have a cause-effect relationship necessarily. I don't. There may be something I don't know about, but because the diabetes affects metabolism and thyroid affects metabolism, yes, they can have additive effects and cause more symptoms, fatigue, for example, because you have diabetes and because you have low thyroid, for example.
Yeah, good. Okay. Well, that's going to do it for today. Thanks again, Dr. Scott, for joining us. Excellent answers, helpful information. We're making a difference, and you know, we love to hear feedback from people. So, Patrick, thanks again for hopping on and sharing a bit of your story. Just want to encourage everyone. You know, the Diabetes Solution Kit is a really good guide and resource, and you know, that's what we're here for. But I just want to encourage you guys to have the the confidence to know that you can do it. You can make decisions each day, each meal, every day. Just, you know, choose what's good for you, and avoid what's bad, and watch as your energy levels change and your symptoms diminish, and, you know, the progress that you make each day. Try some of these things, like we talk about, stopping eating by 6 o'clock, go to bed at 10 o'clock with an empty stomach, and see how you feel. And just find what works for you. That's really key. Everybody is different. There's no one size fits all for everything. Everybody's, you know, got little different nuances, but there are some key foundational pillars that we can practice, and including eating lower carbohydrates. So yeah, we're here for you guys. We appreciate you, and we like to like to know that we're making a difference. So thanks, everyone. We'll be back next Tuesday. Don't know the topic yet, but feel free to submit your questions through email or Facebook, and we'll see you next time. So thanks, everyone.